On your back for me, please. Great. All right, first muscle there is the SCM. You guys remember the actions of the SCM? I know we talked about it in lecture a few times on Tuesday, and I think we mentioned it a week or so ago.
Flexes the neck.
Yep, flexes the neck
Rotates the,
bilaterally
yeah,
when both of them are working, right? Or left and right?
Yeah.
Go on.
Flexes the neck. Hyperextends the head.
All right, so our C1, C0 or our occiput and C1, right? It can extend like the nodding portion, the unnod, the opposite of nodding, right? Okay, good. What else? What's it do unilaterally?
Laterally rotates the head.
Which direction? So let's say
both
we're talking
sides.
about our left one.
So left side and right, well, opposite sides.
Opposite what? No, you're on the right track. Go ahead.
Laterally rotates the head, opposite.
Opposite,
side.
okay. And then it,
Rotation.
yeah, that was rotation.
Oh.
Laterally rotates. It also side bend, can side bend some, right? Which way would it side bend? So my left one would side bend me to the same side, right? Pulls down here, but then I rotate, right? When we rotate, it really pops out. So that's how we're gonna test it in supine here. So we've got our gravity dependent position. So if we're going to, maybe I'll test his right one since I tested his left one on Tuesday. I don't know if was your neck all sore?
A little bit.
All right, so I'm just gonna have the patient turn their head to the left for me, please, and then you're gonna lift that head up off the table for me. Good. All right, and go ahead and relax. So that's my 3 out of 5, right? I test the active range of motion. If they can do that well against gravity, then I know they're at least a 3 out of 5. Things that I want to look for that patients will often do is so go ahead and turn to the left, lift up for me, is sometimes they won't be able to go up as high, or they'll come out of that rotation a little bit and try and kick in other muscles. Go ahead and relax, please. Does that make sense? So just by having them go through that motion, you can get a lot of information. Are they 3 out of 5? Are they compensating? Are they losing the rotation? Are they not coming up as high? So a partial range. Okay, so go ahead and turn to the left again. Up for me, please. Good. Hold there. Don't let me push down. Fight, 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 fight. Okay, so 5 out of 5 for the right SCM. Okay, a 4 out of 5 would be, go ahead and turn left. Up for me, please. Don't let me move you. Hold. Okay, he's not able to resist the pressure. So that would be a 4 out of 5. 3 out of 5 we know is full range of motion. A 2 out of 5 would be incomplete range of motion. Go ahead and lift up. He's not able to fully flex the neck in that rotated position. So that would be the 2 out of 5. And then a 1 out of 5 would be unable to perform any movement, and we're palpating for muscular contraction. 0 out of 5 would be no movement or no palpable muscle contraction. All good on that? Great. What's our next muscle? Oh no. Oh, okay, so cervical extension. Well, let's do flexion first, I guess. Flexion, right? Just straight flexion. Okay, so we're just gonna have them bring your chin up to your chest. Good, hold there. Okay, and then back down. Good, so at least a 3 out of 5 there. Go ahead and do that again for me, please. Don't let me push you down. Hold, hold, hold. Good, and relax. Okay, 5 out of 5. A 4 would be unable to resist the pressure. Okay, 3 out of 5, full range of motion. 2 out of 5, go ahead and lift up. Unable to resist gravity with the full range of motion, right? Partial, incomplete range of motion. And then 1 out of, so that's 2, and then a 1 out of 5, again, we're gonna palpate those anterior musculature to see if there's a contraction. Okay, pretty clear? Pretty easy, right? It's better than having to remember gravity eliminated position.
Thank God.
What's that, Yanni?
Thank God.
Yes, okay. Well, remember, gravity eliminated is always in the transverse plane. Just whatever surface they're on, if you can get them moving in that transverse plane, that's always the gravity eliminated position. So I wanted to scream that at a lot of people during the practical. Just get it moving in the plane of this table, and then you'll be in the gravity eliminated position. Okay, great. So then we got cervical extension, yeah, so we'll have you flip over, Dr. Monty, and have you come to the edge of the table for me, please. So the books will show for cervical flexion and extension, you can evaluate the upper cervical, the C0, C1, the occiput, and the atlas. Yeah, so it would just be kind of there. So that's the kind of C0, C1, all right? We're just gonna do combined motion of the entire cervical spine, okay? So full extension, full flexion, all right? All right, so he's gonna lift up, good, 3 out of 5 at least, all right? Go ahead and lift up again for me, and then I'm gonna apply pressure. I'm also gonna have my hand here, hold for me please, go, 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 good, and relax. So usually when a patient has their head off the table, I like to give them some support, because usually they're there for pain, some sort of discomfort, and usually they're weak, so I like to give them support whether they're supine or prone, anytime they're hanging off the edge of the table like that. That's more comfortable, right?
Mm-hmm.
Than just hanging like that and going into flexion and so. All right, so a 4 would be, go ahead and lift up for me. Good, hold there, don't let me push down, and he's unable to hold against resistance. Again, I like to have my hand in the front there in case they give way. I'm not slamming their head down. We don't have to give tons of pressure here. Just be, we're just trying to get an assessment of how those muscles are working, so we're not real aggressive. All right, number 2, so a 3 out of 5 would be full range. Yanni.
I'm sorry, what muscle testing was that one again?
This is for cervical extension.
Okay, thank you.
Yes. All right, I think the book talks about doing it supine, right, Dr. Monty? Or
I think so.
We could go partial. I think it's a little weird, it's a little different, but so in for 2, what we would do is have him supine. Okay, and then I'm just having him push his head back into the table there to get those muscles going, okay? And then if I see some movement or pressure into the table, I'd give him a 2. Go ahead and try it again. If there's not a lot of movement, I'm just getting a muscle contraction, then I would probably give him a 1 or a trace. Okay, if there's no movement or muscular contraction palpated, then that would be a 0 out of 5.
So that was the same muscle testing, but in supine position.
Correct, for 2, 0 through 2 would be in the supine position.
Okay.
Okay, and they're trying to extend the neck, push the head back into the table. Okay?
Okay, thank you.
Great. All right, next up, trunk flexion.
You do this today.
You want me to do this today?
No, I got it.
I was thinking about that. All right, so here's our trunk flexion. All right, so the patient lays flat, legs down flat, and so the 5 out of 5 position, we're gonna have him put his hands behind his head like that. We're gonna support them at their thighs, hold them down here, and then you're gonna curl up, good, and then back down, good.
Oh, God.
All right, and you probably didn't even need to go up that high. So we're looking at clearing the inferior angle of the scapulae, okay? So go ahead and lift up again, right there, good, and back down, okay? If you feel like it's, I gave him a 4 yesterday, that's maybe a little better. He was still a little shaky, right? So probably not full strength. There was so here's our 4 out of 5 position. Arms across the chest. I'm gonna hold him down here, go ahead and curl up. Good, back down for me. See how that was a lot more controlled? He's probably a 4 out of 5, right? Okay, so 3 out of 5, arms down by your side. I'm gonna hold down, you're just gonna slide your hands down towards the knees and back down. Good. So that's a 3 out of 5. 2 out of 5, incomplete range of motion. Okay, so he's not able to fully get the inferior angle of the scapulae off the table. Okay, and then a 1 out of 5, I'd palpate those abdominal muscles for a contraction.
So the test that you'd want to start with their hands behind their head, if
Sure.
you can't do that, go down to the
Yeah.
thing and then to the side if you can't.
Right,
Okay.
yeah, give him that. Okay,
The weight of your arms creates a longer lever arm. So the further you go away from that rotation, that axis, it's going to be harder. Closer, closer. Does that make sense?
Yeah.
okay. It's like holding the gallon of milk out here versus right here, right? It's a lot more difficult out here. Okay, let's do lumbar or spinal extension for the trunk.
What do you want to do, obliques?
Oh yeah, obliques, yes, thank you. Okay, obliques is kind of the same, except we're gonna add a rotatory component into it. Good, so I'm gonna hold them down here. I'm looking for a raising up of right there and then back down for me. Okay, so that would be a 5 out of 5 if they can perform that. Let's do the same thing. Good. 4 out of 5. And then 3 out of 5, just reaching over. Good. And then a 2 out of 5 would be incomplete, unable to fully get the scapulae off. And then I'm palpating for muscular contraction. Really, I can probably do it both sides, right? Since they both participate. So which muscles is he working, or which oblique muscles?
Internal.
Yep, you're right.
Which sides?
Which sides?
Well, the left.
Left.
Okay, so left. What is causing? What rotation are we causing here?
I was just guessing.
What's he moving? It's okay. What movement? Let's define the movement.
Rotation.
Rotation. Which way?
To the
Right.
side.
Towards the right. Okay, so right rotation. So which obliques are doing which?
The left rotation is internal,
Internal.
and the right one is external.
Left internal.
Yeah, that's what I was saying.
Anybody?
Left external, right internal.
Yes.
There you go. Good job.
So I remember it internal as I, ipsilateral. So maybe then you go the opposite for that. That's the easy way to remember. So I, internal, ipsilateral, same side. And the opposite for external would be opposite, okay?
Yeah, that's a good way to remember it. Okay, great. Any questions on obliques? Okay, great. For extension then. All right, same thing. We're going to support here, and then you're going to lift up, and we got to get the umbilicus up off the table.
Not gonna happen.
All right, so.
I think I'm still sore from Tuesday.
Yeah, this one's hard. This one's hard. All right, so a 5 out of 5, hands behind the head, umbilicus off the table. Okay, so you got to really get up there. All right. Okay, so then hands, I put them behind the back for a 4 out of 5. So go ahead and place your hands behind your back for me.
That's right.
Yep. And then go ahead and lift up again. Okay, you can see how that's full right there. Good. And then arms down by your side, reach down towards your knees as you come on up. Good. And back down. Good. 2 out of 5. Partial range, and then 1 out of 5, lift up, get some muscle contraction. 1 out of 5, 0 out of 5, no movement or palpation. So, okay, any questions? I think that's it.
Yeah, so these are manual muscle tests for strength. How would you test endurance? Muscular endurance.
Make them hold it for like, I don't know, 5 seconds or.
Yeah, so some literature has where you can do an isometric abdominal endurance test. That's what it's called. I'm just holding this position for up to 30 seconds, and I'm just taking that time. Okay, so it's different ways to do that.
I forgot about the 5+ out of 5.
5+ out of 5?
Yeah, that's the Rocky style. So when they're up in a curl, you have to hit the abdomen twice, and if they can still hold it, then they get a 5 out of 5.
5+ out of 5.
5+ out of 5, yeah, that's the Rambo or Rocky style.
For multifidi, what you'll do is you'll get in a quadruped position, and they find kind of a neutral spine. And have you ever heard of like a bird dog position, where they have to hold that? And they hold that usually up to 30 seconds. And if they can't hold, you'll see something like this, or their back will sag, or they'll kind of roll here, okay? So we're holding that for up to 30 seconds is another endurance test. For lower abdominals, Dr. Hedrick, if you want to lie on your back.
Yeah, we didn't do QL or TA.
Oh yeah, we can do that too. Yeah, I can do it.
Okay.
So you'll see this for lower abdominals. Some people like to use this. I don't utilize it, but I just want to show you in case you do see it ever. We'll have the patient pick up their legs. They have to keep their back flat. So that's harder with the longer lever arm. If they can do that here, that's a 5, 4, 3, 2, 1. Okay.
That's easier.
Does that make sense? So, but you're feeling forward to see if the back comes off the table. Okay.
Yeah, they'll.
Yeah, they'll like hyperextend. Okay. I don't utilize that one a lot, but you may see that one, so that's why I put that on there. So, okay, go and bend both your knees,
Wait, what is that one for?
like lower abdominals, okay? Next one here, we talk about transversus abdominis. What I do is I have them in a hook lying position. That means just supine with their knees bent. And I put my hand underneath their low part of their back, and I tell them I want you to find what's called neutral spine, which just means push your back against my hand, and then take it off my hand very slightly, even less than that, right there. Hold that there, and I want you to exhale, breathe out, and pull your belly button in towards my hand, so downward. Now keep your spine at neutral where you're at, keep your belly button in, and breathe normal, okay? That creates that abdominal brace, compresses the abdomen, compresses the spine, okay? We're gonna just keep everything still there. While you keep everything still, I want you to bring one leg up towards my hand, towards your chest. And I'm feeling for any movement on my hand that's underneath. Okay, go back down. If you can hold that there without causing any pelvic rotation, okay? We call that a Sarman level 1, and just different type of grading system. If he can't do that, he gets an immediate 0. So it's not on like a manual muscle test grade. We're taking those out. This is just a specific score, okay? If you can hold that there, neutral spine, belly button in, he brings one leg up, and then hold that there, bring the other leg up as well. Good, and then one leg down, bring the other leg down. That'd be a Sarman level 2. And it goes all, there's more grades than that, but those are usually the first 2 that I usually document. That first session with somebody with back pain usually can't do that, in all honesty. So, Sarman level 0 is he can't keep his spine centered and neutral and it kind of moves all over. Sarman level 1 is he can keep it centered with one leg. Sarman level 2 is 2 legs, okay? So just some different techniques. We hit them all?
QL.
QL, okay. So what's the QL do? Quadratus lumborum? Elevation what? Yeah, it's like a side bend component as well. So the book's gonna show all he's gonna do is kind of hike his hip up toward him. Good, and you're just gonna tug. That's a 5 out of 5, right? 4 out of 5 is just minimal resistance. I can kind of get him to collapse. 3 out of 5 is that full range of motion, okay? Okay, with no resistance. 2 out of 5 can do it barely, can't go full range of motion. And then 1, I'm just feeling for contraction. Make sense? So not really gravity assisted or eliminated, nothing like that. Of course, we talked about that hip hike you can do in class, because it causes that side bending a little bit. But that hip hike in class we talked about. I think that's all of them, right?
Yeah.
Okay. Let's go to range of motion next.